My name is Tim Lantz. I'm with the Chautauqua Clinic here in Fairfield. I'm a licensed mental health counselor, and I do therapy for a variety of conditions. Tonight I'm going to be talking about avoiding holiday depression. And I was invited to talk about this, and a curious thing happened when I was looking through some of the material about holiday depression. Depression certainly can be a problem during the holidays, as it can be the rest of the time of year. However, there's a bit of a misconception about depression during the holidays, that it goes up at that time. And actually, it's fairly stable through that period of time. Now, people do have some distress during then, but it's not nearly to the degree that people realize, or the level of depression isn't necessarily. It is important, however, that I talk about depression, and I'll talk a little bit more about why that is in just a little bit. The reason that I found out and looked at some research that's a little bit new is that they've done some work with a very good database in Olmsted County in Minnesota, where the Mayo Clinic is. And what they found out, and this is what they found out, was that during a 35-year period, the suicide rate in the county did not have an excess numbers during or after Thanksgiving, Christmas, New Year's, or 4th of July holidays. The thing that happened was, though, that they found that suicides are more numerous during the early on in the week and least common on weekends. So there is a pattern that they found out, and they measured a fairly long period of time. 35 years certainly is. The other thing they didn't point out is that suicides tend to be most prevalent during late spring and early summer. And there's a reason for that I'll go into a little bit more later as well. Another study that occurred, and this was one of the largest studies. It measured 3,670 suicides and about 3,300 psychiatric admissions at the VA Medical Center in Durham, North Carolina. And what it found is, again, that there's no increase in suicides or psychiatric admissions around Christmas or New Year's holidays. This is somewhat good news, but there's the other side of it as well, is that people have an impression that there is quite a lot of depression around the holiday season. And indeed, there is quite a lot of distress during that time, and I'd like to talk a little bit about that, and then the season that follows Christmas and how we can prevent more depression during the remainder of the winter season, which is perhaps the more dangerous time for depression. The holiday season is a very different time than what we might have during the rest of the year. And some of the reasons for that is that it carries very different expectations than we might have for a time, let's say, well, summertime or any other time. There's an expectation that we're going to be gathered around the fire, perhaps, with family, and there's a lot of myths that are promulgated during that time, that there's going to be some peace and harmony, and that we'll get along a lot with people. When in fact what happens is there's many other things going on at the same time. It's a time when schedules are disrupted, that we are strapped perhaps for gifts to give, or people don't meet our expectations, and it can be a difficult time in that regard. It can also be a time when we think that people will be exceptionally grateful. Let's say if we're talking about parents that give their children gifts, that the gratefulness will be in proportion to the amount that the gift might have caused, and that's not necessarily true either. But we many times have those unrealistic expectations, and so it can have a difficulty for us. It's also a time when, like I said before, there's disruptions in schedules. And so we can have less sleep, poor diets. Some of us even partake more than we would at other times in alcohol. And that can have an impact upon the level of stress and ability to cope that we have. Another thing that happens is that because of the increased visitation that we have, we get together with family members. And usually most of us look forward to that. But another side of that is that if there is unresolved dynamics or conflicts that happen within a family, an extended family, then as they get together, there again is an expectation that somehow those will almost be magically resolved around Christmas. But it's a very intense time of year when there's lots of family together, and maybe the same difficulties that might have existed in a family when, let's say, an individual is growing up, they can still exist if they haven't had a chance to talk about that. And so those can come to the surface during family gatherings as well. What to do if you find yourself stressed? And by the way, some of the things that you can recognize as stress during this time are some of the symptoms perhaps we should think about are if you have some physical symptoms like dizziness or faintness, unsteady feeling, tachycardia, palpitations, trembling, shaking, twitching, increased irritability. That can certainly be a time that it happens. Abdominal distress, numbness. If you find yourself with increased anxious apprehension, you're worrying more, fatigue easily, difficulty concentrating. A lot of those things are indications of increased stress, and many of them are also indications of depression as well, but they can certainly be indicators of stress during the holidays. Well, some of the more obvious things that a person can do during the holidays is to take care of themselves better. And I know that's easier said than done during the holidays when there's other things to do. But in order to take care of yourself, things that are obvious like not increased, but maintaining a regular exercise program. Also treat yourself to a balanced diet. There's a tendency to maybe overindulge at some times and then try to compensate for that at other times, and the balance of the diet tends to suffer then. In a related way, one of the better things a person can do is learn some new social skills. In other words, if they're trying to balance out their social contacts, learn how to say no to invitations if you feel like you're overwhelmed or don't feel like going to one that you've been invited to. Another thing that a person can do is in balancing out social contacts if they find themselves more isolated, is to learn how to invite people to get together with you. And take a risk or two at that time of year to help yourself out with increased stress. As I said before, it's a time that can be stressful, and as a person moves through the holiday season, they can move afterwards into the time of the winter months, January, February, and so forth. And those times can be particularly difficult for depression. Particularly difficult. If there is a subjective mood of depression, that's an indicator of depression, certainly. Irritability, less interest in activities that perhaps a person has enjoyed in the past. If there is either an increase or decrease in appetite or a sudden weight change, that can be an indicator of depression. If sleep patterns have changed, perhaps they're sleeping less, or sleep is disrupted, or they are sleeping more than they have in the past but don't feel rested. That can be something that will indicate depression. If they have difficulty with concentration, and certainly if they have thoughts of escape, if they have thoughts of harming themselves. And all these things are indicators of depression. What a person can do about that is, in many cases, similar to what they can do about stress, and goes for what I said before about diet and exercise. But in addition, they can take a look at what their own thoughts are around that time, particularly if they have some awareness that they may have a tendency to be depressed. If they can do things, seemingly simplistic things, like make a list of the things that they're grateful for, to turn their thoughts around towards things that they find enjoyable. Perhaps intentionally plan activities that have a pleasurable component to it. Again, watch out that they're not becoming too isolated, that they can intentionally seek out regular contact with friends. In fact, that's one of the clear danger signs, increased isolation, and the level of connectedness that a person has with family and friends in their community. As that goes down, as a person feels more and more apart from what's happening, the risk of depression increases. I should say something also about the relationship that depression has with grief. The holiday season, and I'll backtrack a little bit here, the holiday season is one in which, as I said before, has many connections with family members, but it also is a time that has some particularly significant or intense cues to remember people who have died. And the grief associated with that can be particularly intense. There are parts of that that are similar to depression, sadness and a sense of isolation. But this is very much a time of grief instead. And the ways of dealing with that can be very different. The sadness is real. It's not something that a person gets over. It's a time of healing, and it takes additional time, more than what one might expect with even major depression of a moderate intensity. So I did want to mention that because sometimes people have an impression that after a few months or maybe even a year that they should be able to pull themselves out of a time of grief. But the holiday season tends to contain, like I said, many cues that will trigger intense grief. That does lessen it over the years, but it still can be revisited. I've talked about depression as if it's a one type of an entity or one type of a condition. There's actually several different types of depression. There's unipolar depression, where a person simply has the low. There's also bipolar depression. Sometimes it's called manic depressive illness, where they have a very high time. They feel euthymic or an overly enthusiastic, energetic appearance. And that can cycle into what's very similar to a major depression after a while, and then back up again. The problem with the manic behavior is that it tends to be disorganized after a while, that a person jumps from task to task and has difficulty with concentration. There is another type of a depression which is called SADS, or Seasonal Affective Disorder, that tends to affect, well, women beyond the age of 40 happen to be more at high risk for that. As the light during the season becomes less and less, they tend to be more prone to depression during that time. Treatments for depression. There is, of course, medication, and it's important to visit with a doctor to find out whether medications might be appropriate for your conditions. It's also important, I should say, to visit with a physician to find out if there's any physical condition that may, in fact, be mimicking signs of depression. So there's also several forms of therapy that have been found to be effective in outcome studies for assisting with depression. And as far as a comparison of the two, cognitive behavioral therapy or interpersonal therapy is probably equal to antidepressant medication in treatment of depression. So, just a brief wrap-up of what we've talked about today. The holiday season is indeed a stressful time, and a person can become overwhelmed by that. They can feel that there's too much to do, or conversely, sometimes if they've been busy in years past, they maybe feel like there's too little to do. But what we're looking for is a balance with that. And as I've also talked about how a stressful time during the holiday season can lead into the winter season, and how that winter season is a particularly vulnerable time for developing depression. Managing the holiday season is important for avoiding depression later on in the winter. I would welcome some discussion or questions at this time.
I think the few days after the holidays is almost worse than going through the holiday itself, because you've been so busy, and all of a sudden there's nothing.
The comment was that the time immediately after the holiday, during the 1st of January, perhaps the week or so then, is perhaps worse than the holiday season. And I think you're right. Yeah, I would agree with you.
Not if you have a birthday after Christmas.
And that is held up indeed by statistics. There is an increase in, a short increase in depression and suicide rates immediately after the holiday season is ended. It isn't a very long time period, statistically anyway, but it does increase briefly during that time period. It's similar to the finding I mentioned earlier that suicide rates are highest at the beginning of the week, Monday or Tuesday, and not what a person might expect during the weekend.
Monday or Tuesday?
At the beginning of the week,
Oh, yeah.
yeah. Mm-hmm.
Check on it.
I will.
Yeah.
How can you tell when grief has gone into depression? I mean, how can you tell the difference? I mean, how do you know when you've gone beyond grieving into a depression that needs to be treated?
Mm-hmm. That it can be difficult in that there's many of the same symptoms that are present. If the thoughts of a person are directed at the loss, then they're still within a grieving period. And that's a very rough idea of how you can tell the difference versus in a depression, more of a uniform hopelessness. And many people make the mistake of thinking that there's a certain time period that we have to watch out for with grieving. But grieving is a very individual process, and what one person may experience over a 2 or 3 month period of time, another person may experience over many, many years. So it's not necessarily the time period. Those people around us, if we've had a loss ourselves, those people around us, if they're not directly connected with the person, may believe that grieving should stop after as short a time as that 2 or 3 month period of time, or 6 months. And it simply doesn't. The loss is too great if it's a spouse or a child. So, other thoughts?
Hey, when you talk about depression and suicide, like they're sort of, one leads to the other, I mean, that's not necessarily, you can be very depressed for a very long time and not necessarily be suicidal, can't you?
Oh yeah, that's right. And it doesn't lead to the other. One depression doesn't lead to the other, but I guess I was talking about depression and suicide because in those studies, that's one of the main indicators of the level of depression or that may be present in the population at that time. And it's not an accurate indicator of the level of depression that may be going on exactly, though. One of the things that can happen too is that it's said that women have a higher rate of depression than men do. However, women attempt suicide more, but men succeed at suicide more than women do. That men tend to not seek help for depression as soon as women do. Once they do seek help, their level of depression is more severe than women's usually is. But yes, a person can have depression for a very long time and never make a suicidal attempt.
Or vice versa. I had a family member who committed suicide, and none of us in the family had the slightest idea that he was depressed. And I don't know whether he was or wasn't.
Mm-hmm.
I mean, we'll never know, I guess, why.
Mm-hmm.
But if anything is depressing, is having a family member commit suicide. It's the most depressing thing that can happen to anybody.
Yes, it is depressing. It has a profound impact upon a family to suffer a loss through suicide. Mm-hmm. Men tend to talk about suicide less. And so by the time they have reached a certain point, they're closer to taking that action themselves. Young people, particularly males, adolescents, teenagers, tend to be more impulsive about suicide. Other thoughts?
I think the weather has a lot to do with how we feel. When we come along, maybe on a weekend, where all of a sudden the weather's yucky and we feel bad, so what you do, you get in your car and go someplace, or you call somebody,
Uh-huh.
meet you for coffee, that's what I do.
But I'll
And-
just sit home and cry.
And the weather does have an effect on people.
But that's not good.
I know, but that's what you.
And how much light there is,
Mhm.
how much light there is outside. If it's a sunny day, it tends to affect mood quite a lot. That's one of the main reasons I didn't mention before that there is a treatment for seasonal affective disorder, which is light boxes. one of the best things a person can do during the winter months, if they don't have a light box or a light source, a full spectrum light source, that gives them a required number of lumens, is to take regular walks outside. You bundle up and go outside when you can. If a person is going to work or has activities when they're arriving to work or whatever they're going during the morning when it's still dark outside, staying inside and then leaving about the time that it's turning dark again, they're not getting much light, and that can certainly affect their mood. So if a person can plan on time to be outside, and it doesn't take a long time to get sufficient light, but I think you're absolutely right, level of light that you get has a huge effect on mood. When people are treated with light sources, sometimes they give themselves a certain amount of time per day for exposure to light, and they may find themselves too enthusiastic after a while and have to cut down on the amount of time because their energy level has gone beyond what they'd want it to, if you can imagine.
I should try that. Where do you get those light boxes?
I have some resources for that. I couldn't tell you off the top of my head, but I do.
Is it a special light? Or
It is. It is. It has to be a certain amount of light that you receive, and they've refined the delivery instruments, if you will. It used to be a huge light that you mounted on the ceiling, and then they've shrunk it down to a table model, and I understand now, although I haven't seen one, that there are units that you can wear like a pair of glasses that will shine light for you.
Just turn the light on, doesn't it?
No, this type of light doesn't help.
Now,
Mm-mm. No.
Tim, you talked too about sleeplessness. Now,
I did.
is there anything, any suggestions that you have for us, those of us who don't sleep at night, besides taking sleeping pills, which I don't like to do?
I
think
can
there must be some other way.
talk about some general sleep hygiene things that a person can try over a period of time to help with that. One of the patterns that people many times have is to keep track of the time. And they will wake up in the middle of the night, they'll turn over and see,
what time it is.
oh, it's 3 in the morning,
Yeah.
and I have this and this and this to do tomorrow, and I'd better get to sleep. And in effect, what that means is they turn back and they try really hard to go to sleep. I'm going to force myself to go to sleep. Well, even when we say it, we know that's ridiculous. Sleep doesn't work that way. And so one of the things that a person can do is to set their alarm for when they need to get up, and then take the clock, put it under the bed, drape a tea towel over it, turn it around, whatever they need to do so they can't see that clock. The reason for that is that all of us have a very frequent mini awakenings, several of those during the night. But if we're prone to sleeplessness and we look at a clock, just our brain seeing the numbers and recognizing what it is can make our arousal that much higher and that much less likely that we'll return to sleep. So turning the clock around and not looking at it can be one of the things that can be helpful. I once visited a patient who I had gotten a consult on. I did some relaxation therapy for the person, but his main problem was that he had been waiting for several months for a heart. He was a transplant patient. And the lights were quite bright during the night from the nurse's station that came in. And when he would lay in bed thinking about when he would receive a new heart, he would open his eyes and look up, and there was a clock on the wall with a large sweeping second hand opposite his bed that he could see. So the treatment for him, for his sleeplessness, again, was relaxation training, but it was also a piece of paper that was taped over the clock And after a couple nights, he was sleeping much, much better.
Because I have that clock, I gotta look at that all the time. I gotta know what time it is when I wake up.
Another one of the things that a person can do is to start to train themselves to go to sleep, to get as much rest as they can, even if they're not sleeping. And to do that, what a person may do is find a moderately interesting book to read, park it beside the bed when they're not sleeping after a time period. I can't say how long since the clock is covered, but turn the light on, pick up the book and read. And read until your concentration starts to fade, until the person doesn't know what they read at the top of the page when they get to the bottom. Then you close the book and set it down and wait for themselves to go to sleep. And if they don't go to sleep, they pick the book up again after they turn the light on and read some more. I have a book beside my bed that I get drowsy when I even look at it sitting there. Yes?
Well, I found if I can just stop thinking, I'll go back to sleep, just like reading the book, or if I turn on the TV for a few minutes, I'm out.
Mm-hmm.
Or if I listen to a book on tape, that kind of helps me, because then I don't have to turn on the light or anything and trying to turn it off. I just start listening to it. And as soon as my mind stops thinking about my own thoughts, I'm out.
Mm-hmm.
Just getting with that anxiety thing.
And of course, a person, in order to distract themselves enough from their own thoughts, it doesn't work simply to say, stop thinking about, well, you get my point if I say none of us should think about pink polar bears. The more we tell ourselves not to think about something, the more it's there. And so we do have to do exactly that, which is to look at a book or watch TV or a movie or a book on tape is an excellent idea, actually. Mm-hmm. Letting go is what happens when we go to sleep. And to try harder is the very opposite of that. Okay.
Cardinal